Basically, just to give you an idea of my practice. Again, I inherited it from my father. He was a GP, practiced in the late 50s, early 60s, up through the 90s, and he accepted chickens and eggs as payments, and he did quite well. I don't think he made a lot of money, but he saved it, so he did well, and a lot of us would, including myself, would be do well to follow his example. Basically what happened was when I took over his practice, I took it to the local hospital, to the Catholic hospital group, was very frustrated there because I felt like I had overlords who were telling me how many patients I had to see over how much time. I didn't have control over my day. The folks who wanted to go home early, controlled my schedule. And it was very frustrating because I didn't think I could serve my patients very well. So after about 4 years of that, I took the practice private again. And this is just to tell you what it looked like as a couple years ago, before we decided to go to the third-party free model. We're a solo family practice in a fairly suburban area. The office is attached to our house, so I did follow my father's model there. He practiced out of his house as well. We had very lean staffing. I think MGMA says a primary care physician should have 3 or 4 staff. We had 1 full-time, 1 part-time, and my wife is our office manager. She'd do the billing and so forth on weekends. So we were already pretty lean. I gave up hospitals, didn't do nursing homes, gave up obstetrics a long time ago. Although I'm family practice, I love seeing kids, but see primarily adults. And I was not accepting Medicaid since my practice went private ever. And because of the financial constraints of Medicare, I had stopped accepting new Medicare patients, but my Medicare practice was about 50% of my business was Medicare already. I couldn't afford to do any more than that. But we were always accepting new commercial patients and patients who paid cash. Maine is a pretty rural state, fairly small population of 1.3 million. Politically, it's very deep blue. The 2 most well-known politicians from Maine are the ladies from Maine, Senators Collins and Snow, who are in name Republicans. Senator Snow retired, and she was replaced by an independent, and an independent in Maine means unenrolled Democrat. So anyway, that's the climate we are in. The average age in Maine is the highest in the nation, basically because all the young people move out of state because there's no opportunity. The population is one of 2 in the nation that's shrinking. I think West Virginia is the other. And we have a very generous entitlement program, so we attract a lot of people who are taking as opposed to giving. And greater than 25% of the state is on Medicaid, and they're actually debating in the legislature whether or not they want to expand that further. Portland itself is the largest city in Maine. It's basically a big fish in a small pond. Greater Portland population is 200,000. It's a sanctuary city, so we have a lot of Somalians and folks from Africa and other countries coming in, which do put a burden on our social service structure. And we have a rising homeless population and panhandling, rising taxes to pay for all this, and a shrinking tax base as people are moving out of state. Portland's medical climate, there's one 600-pound gorilla academic hospital, and as Andy had mentioned, this is the one that's buying up other hospitals in the state and buying all the practices. One Catholic hospital, which is failing and has recently been bought out by another academic hospital about 100 miles away, trying to get a foothold into Portland. There are several big box practices owned by the hospital and a couple private groups. And the few independents that are left, in terms of PCPs, are really struggling to try and eke out a living, usually by taking on another niche like Botox, weight loss clinics, or some are going to OMT and dropping the primary care. We have a big DO population in Maine. And one of the organizations that was supposed to be our advocate was a physicians' health organization, originally formed by physicians for mutual support and collective bargaining with the insurance companies. Unfortunately, it was taken over by the academic hospital system, and very soon we realized that the doctors were working for the organization and not vice versa. And they did this with a great deal of arrogance. Anytime we questioned what they did, we were just told we didn't know what we were doing and we just had to listen to them. We found that there was a lack of transparency. When we signed on to the organization, they negotiated a lot of our contracts with the payers. And then when we got in, after being in the organization for a while, I asked to see the contracts that I was bound by, and I was told that I maybe could go to their office and look at them, but I couldn't have a physical copy. So that raised a few red flags. And they decided to form an accountable care organization. I'm sure that most people in this room know what that is and why I was morally opposed to being a part of such an organization. And that was really the last straw, because they had told me that joining the ACO was required for continued membership in the Physicians Health Organization. And if you're part of an ACO, you have to be certified as a patient-centered medical home. That was mandatory, and if anyone's ever done it, I went to the website to look up what the requirements were. When I printed them, the requirements list was 45 pages long, and that was going to entail several hundred hours of work, again, not seeing patients, just satisfying paperwork for some administrators. They also wanted me to go to their library, read an article, and attest that I would behave by a code of ethics that they determined for themselves. And one thing that really was telling was they demanded a digital copy of our letterhead so they could communicate to our patients on our behalf. And when I questioned all this, they said, well, you really have no choice. And what happened was the medical director of the PHO, to be helpful to educate us, all the doctors that were protesting this, he sent us an article which was basically a journal written for hospital administrators. And I read it: transforming small independent practices to patient-centered medical homes is widely believed to be a critical step in reforming the U.S. healthcare system. Our team has conducted research on improving primary care practices for more than 15 years. We have found 4 characteristics of small primary care practices that seriously inhibit their ability to make the transformation to this new care model. We found that small practices were extremely physician-centric, lacked meaningful communication among physicians, were dominated by authoritarian leadership behavior, and were underserved by mid-level clinicians who had been cast into unimaginative roles. Our analysis suggests that in addition to payment reform, that a shift in the mindset of primary care physicians is needed. Unless primary care physicians can adopt new mental models and think in new ways about themselves and their practices, it will be very difficult for them and their practices to create innovative care teams, becoming learning organizations, and act as good citizens within the healthcare neighborhood. So that really convinced me that I should be part of that organization. Well, we showed them that we did have a choice. I immediately resigned from the PHO and opted out of Medicare effective April 1st of last year, and at the same time really jumped headfirst into it and canceled all our insurance contracts. And what we did was we notified our patients by mail. Because we were no longer trying for meaningful use, we junked our EMR and have not been happier. Set up, thank you. We set up a do-it-yourself website, and I guess I know it's not high tech, but it's quaint. It cost us about $100, and it did crash once, but that was when it was referenced on Drudge Report, Huffington Post, Facebook, and so forth. So it did crash once, but for the $100 we spent on it, I think that was a pretty good deal. What we did was we published our prices online and in the office. We do a little bit of advertising on talk radio. And again, we got some free publicity when an article in the Bangor Daily News, which is a relatively small newspaper, it went viral and got us quite a bit of media attention, which free publicity is the best publicity. The result, we had a wide range of emotions, reactions from our patients. Again, we opted out on April 1st, so people were wondering if it was a joke. There was disbelief, confusion, anger, and fortunately there was a fair amount of support. We did get a lot of blowback from the insurance companies. I won't go into full detail, but the insurance companies actively called patients and told them that they needed to stop seeing me. They told them that any prescriptions that I wrote would not be covered, which was a lie, but I didn't have it in writing, so I couldn't take it to the insurance commissioner. So that scared a lot of patients away. I was undermined by the local AMA chapter. On one hand, the executive director tried to make nice because he didn't want to be seen as attacking a physician, but I found out from other folks that he was behind the scenes working to try and squash what I was doing, telling people that I was just a crazy radical and not to pay any attention. I was cheered on by colleagues, usually very privately, and again, we did get a fair amount of media attention. The results, we had a real big party because in the first week or two, the most demanding PIA, and I think you know what that means, patients left immediately. These are the folks that demanded all your time, felt like you were their servant, and you were getting paid by the insurance companies, and you're a rich doctor, so do everything that we want you to do. So that was great. Never felt better. The unfortunate thing was that most of our Medicare patients have left for the reasons that they were talking about before. Again, these folks cannot get reimbursed by Medicare, but the Medicare patients that have stayed, I treat them like gold because I know that they're seeing me because they want to, not because it's just convenient. Most of the HMO patients were forced to leave because of the network rules. Nothing in terms of referrals and CAT scans could be done because I was not contracted. Some PPO patients left, again, because I think the insurance companies were somewhat deceptive. And some of them just said, well, you don't take my insurance, so I guess I'm out of here. Even though I tried to educate them about, they would be spending less with me than they would be with folks that were in network. But we did have a lot of patients with high deductibles and no insurance come in, and they've been coming in steadily. We see several new patients a week. Our findings, who will stay with you is very unpredictable. I've had millionaires leave who could certainly afford to stay. I've had people that I know have very little money stay with me because they trust me. And when I see those folks, I am gratified, and again, I treat them like kings. There will be a lot of confusion no matter how much you try to educate people. Sometimes support is a mile wide and a foot deep. People are right behind you until they find out that, this is going to cost me a little bit more out of pocket. Well, it was nice knowing you. Some patients will be evasive, if not manipulative. calling up saying, yes, I'm going to come in, but give me another month's refill, as they know that they're looking for another doctor. You can put up with that for a little while, but then you just have to call their bluff and just tell them they have to make a choice. You will attract some drop-in patients thinking that you're now an acute care clinic. Some people will think you're a rich concierge doctor. And you'll get some unwanted attention from drug seekers because they think there's a new doctor in town that just fell off the cabbage truck, and it will be an easy mark for getting prescriptions, but they get educated very quickly. And we experience a wide range of emotions. Again, we went through the stages of grief when we lost great patients. We were happy when we lost patients that weren't so great. It changed on a daily basis. We found we had a lot more flexibility to work with folks. We feel very appreciated because we know people are there because they want to be. We have a lot of freedom, and I really feel like a doctor, not a drone anymore. As one of my mentors in residency said, good judgment comes from experience, and experience comes from bad judgment. Lessons learned. Plan on rebuilding your practice. Don't assume that everyone will stay with you, because when dollars count, sometimes people will walk. Mentally fortify yourself, your staff, and your family, because sometimes the transition can be rough. And again, it really all depends on your demographics and if you have anyone going with you. If you have other doctors going this route, it might be a little bit easier. And again, plan for the transition carefully, work on patient education, watch the deadlines. Again, the opt-out deadlines, you have to do it 30 days before the first quarter. You have to give the insurance companies often 90 days notice. So you have to be careful about that and plan accordingly. And also you have to decide for yourself, are you going to go cold turkey like we did, or are you going to start knocking off the worst payers first and develop a strategy for doing that? And you, again, want to budget for the lean years. Use your lines of credit. If you have money in the bank, we didn't, because again, we were a small family practice struggling to make ends meet. But the good thing is, we're not using the credit cards anymore. We're making ends meet, and we're chipping it down now. Our future, we are achieving financial stability. Right now, I'd say we're surviving, and thriving is right in reach. We're seeing several new patients a week, and they're very happy. Some of them ask why I don't charge more, because they spend more at the beauty salon or the auto mechanic. We are now talking with self-insured employer groups. They love what we're doing. All our rates are well within reasonable and acceptable rates. They're happy to pay us 100%. We're looking to do worksite physicals. Go back to the old days, like my dad had been the company doctor for several companies in town. That model may be coming back. They look at it as a huge boon because it saves them money, as well as maybe reducing their workman's comp costs. We're looking to add new services. Next week, we're going to start laser pain treatments. Telemedicine, we're talking about it, but I'm not sure where that's going to go. And we've started to dispense generic medications. And Josh is going to talk about this, but we are now going to offer a subscription plan. I won't go into that because that's what Josh is going to talk about. And that looks like it's going to be a great supplement to what we're doing as opposed to fee-for-service. But I like doing both because folks that would only need to see a doctor once a year or so may not be interested in a subscription. But for the folks that need chronic ongoing care, it's great. So we're looking to do a hybrid of both models. And with that, I'll end.